Good day, and welcome to Massage Matters on Community Connection. I'm your host, Chris O'Connor. Massage Matters is designed to give you a hands-on look at the various manual therapies that are available to help you heal your mind, body, and spirit. Massage Matters strives to raise the awareness of these therapies within the community. My hope is that by explaining them and then demonstrating them, those of you watching will put them to use, encouraging you to become more involved with your health care. Each week we'll feature a specific technique, and in some cases we'll bring an expert guest on board to teach us what we need to know. Some of these therapies you may be very familiar with, but I'm sure there are some that will be completely new to you. And after we've demonstrated these techniques, I think you'll be better equipped to decide which treatment is best for you. Today's show will be all about massage therapy. We'll go over some of the reasons people get massage, specific conditions massage therapists treat, as well as gain a better understanding of how your body works. We'll cover what you could expect from the time you walk into a massage clinic, the actual treatment itself, and what you might be feeling after the treatment's finished. Well, I'm ready to go, and I hope you are too. So let's get started. According to the Massage Therapists of Ontario, massage therapy consists primarily of hands-on manipulation of the soft tissues of the body, specifically the muscles, connective tissues, tendons, ligaments, and joints, for the purpose of optimizing your health. Modern massage techniques can be traced back to the 1700s and the development of Swedish massage, which was the first systematic method of therapeutic massage based on the body's physiology. Now, today, massage therapists use their knowledge of anatomy and physiology to combine traditional Swedish and more modern massage therapy techniques and exercise, and combine them with other therapies to treat their clients. As massage therapists, we're required to continue our education throughout our career. This is usually accomplished by learning modalities that already complement how we're already treating. It's not uncommon to find massage therapists have a long list of techniques available for you to choose and to utilize during a treatment. Things like osteopathy, acupuncture, Bowen therapy, deep tissue massage, myofascial release, and craniosacral therapy, or just to name a few of them. There's a concept I'd like to introduce to you now. It's called tensegrity. Now, this is a term that was coined by Buckminster Fuller. He was a mechanical engineer, architect, author, designer, and an inventor who lived from 1895 to about 1983. Now, tensegrity is the joining of the words tension and integrity. And this right here is a tensegrity model. Now, you can clearly see how none of the dowels are actually touching each other, but they're all connected to each other. What I do to one dowel is going to have a direct effect on the rest of the dowels. Okay. Now, for a long time, it was a held belief by science that the bones were actually the structure of the body. But the new understanding that's sort of formed over the years now is that it's the soft tissues that actually represent the structure of the body. And here in this case, the elastics are representing the soft tissues of the body. And this is how your body is designed right down to the cellular level. So you can see when I push down on the model, you can sort of see how the weight gets displaced, and then the model comes back up to full size again. Okay, so I push down, it springs back. You can imagine somebody with a big weight across their shoulders, or maybe somebody with a heavy backpack bending down to tie up their shoes. Okay, now normally our bodies can handle this stress and we place on it, but sometimes what happens is one of these elastics can go loose. I'll show you here. So if I detach one of these elastics, you can see how the structure, it still maintains its shape, but it's actually deformed a little bit. And this is how our body compensates for this elastic being loose. Now, this elastic could represent a muscle, it could be a ligament, it could be a tendon, joint, organ in the body, and this represents a dysfunction. So you can see how the rest of the body has to try and deal with the problem. And in some cases, some elastics will go tight, and some elastics will actually go, you can see on this side here, I'll show you, actually go a little bit loose. Now, it's usually when we run out of these compensatory changes that the real problem starts to take place. This is where we can no longer deal with it. So over time, this overworking of the body, that's going to lead to pain and dysfunction. Okay, what massage therapy focuses on doing is to bring the body back into balance by helping the body get rid of that dysfunction. Okay, so the number one reason people go to their doctor or the emergency ward is actually pain. Now, I'm not saying that massage or any of the other techniques we're going to discuss on the show are going to be able to fix all the problems you might be having with your body. What I will say is that they can have a dramatic effect on your recovery. Now, all therapists have a great education when it comes to understanding how the body works, which means not only can they help you relieve some of the pain and dysfunction, they can also explain to you what might be causing it to happen. Oftentimes, just having your symptoms explained can really help reduce the pain and anxiety that you might be feeling. Now, typically when you go for a massage treatment, you'll be required to fill out a few pages of information in the form of a health history. This provides the therapist with a general idea of your current and past health. When you go into the treatment room, the therapist will go over what's called the 7 steps of consent. These steps are to make sure you fully understand everything that the therapist is proposing to do and that you're completely okay with it. All right, this applies not only to your treatment, but also any assessment or special tests your therapists feel that are necessary. Most assessment is in the form of testing your soft tissues and your joints. The therapist is really looking for restrictions, weakness, pain, anything that might be associated with movement. In some cases, pain can be found simply by palpation. You might be asked to walk back and forth a few times up and down a hallway or something like that. The therapist is just trying to get an idea of how you carry your body and wants to see the general symmetry. Once the assessment's finished, the therapist has a really good idea of the areas they want to treat. So most massage treatments take place while you're lying on a table, sitting in a chair, or lying on a mat on the floor. You may be clothed or unclothed depending on your comfort level. In the case of the latter, the parts of the body that are not being massaged are always covered with towels and sheets. So after the assessment, the therapist will direct you to undress to a level that's comfortable for you. Get on the table under the sheets and wait. Of course, the therapist will leave the room and give you your privacy. One of the major goals of any massage treatments is to get you to relax. The more you can relax, the better the treatment and the longer its effects will last. So some therapists will use aromatherapy or music to help you get into a deeper state of relaxation. However, they'll always check with you first to make sure that you're okay before using any scent or any music. Most treatments last 30 to 90 minutes depending on what the treatment's for. In massage therapy, treatments are usually covered under your extended health benefits packages that you have through your employer. Still amazes me that people, some of them who've had these benefits for 12 years, have never had massage therapy. A good friend of mine put it well when he said, it's only a benefit if you use it. So I hope if you fall into this category, you'll take immediate action and start using your benefits to your advantage. Now you may be someone who has unfortunately been involved in a motor vehicle accident. Massage therapists can be of great help to you. However, I will suggest that you go to a multidisciplinary clinic to get your treatments. Multidisciplinary clinics have physiotherapists, kinesiologists, athletic therapists, and so forth who can help out with your treatment. It's the best way to make sure you're getting all the care you need, and rather than having to go around town to different clinics, it's one-stop health care. All right, it's time for a commercial break. And coming up after the break, I'm going to take you through some of the more soft tissue dysfunctions massage can treat. And I'll be able to walk you through what a typical massage treatment looks like. You're watching Massage Matters on Community Connection here on Rogers TV, so stay tuned. Welcome back to Massage Matters. Let's talk about some of the soft tissue and systemic dysfunctions which can lay hold of us and can be treated with massage therapy. Some of the most common dysfunctions we see as therapists are strains and sprains. Frozen shoulder, we get a lot of back pain, neck pain, tension and stress, of course, headaches, plantar fasciitis, we see tennis elbow, golfer's elbow. A lot of people suffer from chronic pain and fibromyalgia. Massage is great for that. What else? Temporomandibular joint dysfunction, which is where, for people who grind your teeth at night. Massage is really great to help that out. If you've ever suffered from whiplash or from sciatic pain, sleeping disorders, shin splints, massage is also great during pregnancy. The list really goes on and on. The one thing I wanted to focus on is something called myofascial trigger points. Now, myofascial trigger points are areas in the muscles that can cause local pain and referred pain. They can cause muscle weakness and other autonomic phenomenon. Brought a chart in with me today. And as you can see on this chart, the black X refers to the trigger point, in this case the upper trapezius muscle, and you can see the red and the dotted red, that indicates the referral zone. So you can see how this trigger point here could easily mimic a headache. Okay, this area here is one of the most common places for trigger points in the body, and that's why everybody loves to have their shoulders rubbed. This muscle here, your sternocleidomastoid, you can see as well, it can refer up into the head, again, headache type, down into the chest a little bit. Oftentimes this is injured during whiplash types injuries, or if you're working at a computer for long times or commuting. These ones here at the bottom, you can see the referral pattern is actually into the teeth in some cases, so they can mimic a toothache. All right. Massage therapists use direct pressure to relieve the tension in these areas by allowing the tissues to return to normal. All right. Basically, they just warm the area up and then press down. Oftentimes, myofascial trigger points can go undiagnosed, and this results in prescription medication and sometimes over-the-counter medication being ineffective to help relieve headaches. Now, let me stress that not all headaches are caused by trigger points. What I'm getting at is proper assessment and treatment of these affected areas can relieve the symptoms of the area that's experiencing the pain without actually treating the painful area directly. Massage therapists come out of school with a full tool chest of knowledge on how to treat all the conditions I've mentioned. The best way to find a massage therapist to help you with any of these dysfunctions is to ask family members, co-workers, friends, other healthcare professionals, basically people you trust. Ask them who they see, and then follow up from there. Welcome back. Well, we're here at the table, and what I'm going to do is I'm going to take you through some of the things you could expect to happen during a massage therapy treatment, sort of how the undraping goes. As I explained earlier, some people will be more clothed than others, so I just want you to be secure and have a great understanding of how we expose the different areas of the body parts that we're going to work on, and just kind of take you over the different areas of the body that the massage therapist treats and why we treat them. All right. So as you can see, Rob here is laying face down the table. The table has a nice armrest, face cradle for him to relax. All right. He's nice and fully draped. You can see nothing showing. All right. Rob's wearing a pair of shorts, just so you know. We'll see that in a second. Now, as I talked about earlier, massage therapists work from head to toe. Now, depending on the type of therapist, it'll depend on where they start, where they go to. For me, personally, if I'm doing sort of relaxation or helping somebody relieve some tension, I like to start down at the legs. Working on the legs just introduces the person to my touch. We sort of can build a rapport. If it's somebody I've never met before, they can start, we can start building sort of a trusting relationship. Okay? So what I'm going to do here is just expose Rob's leg. All right? So, I don't know how well they'll see it from there, but what I do is I just push it back to about Rob's knee. You can see that's the back of Rob's knee here. All right? So I just lift up and I pull my sheet up sort of in this fashion, and I'm going to let Rob's leg come back down. I tuck my sheets in here, okay? And that's sort of what it's going to look like. Sometimes if the person's undressed to their underwear, or if they're not wearing underwear at all, we'll come up as high as what's called here as the glute muscles, okay? But we never go beyond that, just sort of about halfway up to where your hip is there. And this gives the therapist a lot of access to work on your feet. Therapists will work all over your hamstring muscles. They can work on the side of your leg. Down here, the gastrocs muscles are often, and your soleus muscles, down here, your calf muscles, are often very tight. We carry a lot of tension there because we use these muscles a lot for standing. If your feet aren't too ticklish, always nice to have your feet massaged. It can help just overall. Maybe another time we'll talk more about reflexology, which is something that deals specifically with the hands and the feet. But for today's show, I just want you to get a really good idea of what you could expect so that there's no surprises. So I'm just going to lift this up, bring it back. And of course, if we worked on both legs, I'd go around to the other side of the table and work on his other leg. Now, working on the back, neck, and shoulders would do is just tuck into the short line here. And again, we just expose the top of the hips. We don't expose the gluteal cleft, which would be sitting right around in this area here. And this gives the therapist nice, easy access all over the back, neck, and shoulders. One of the main concepts of Swedish massage therapy is to direct our pressure towards the heart and the lungs, and then have easy pressure off. So we're sort of pushing towards the heart and the lungs, and then easing the pressure off. Again, as you can see, we were able to cover a vast area on Rob here. If we were to treat, we can get the back side of his shoulders, we can get low back, we can get his middle back up into his neck. Oftentimes your therapist will move around from space to space, working their way through the tissues. As they soften, each layer allows them to get a little bit deeper and deeper into the tissues. Okay? So, what I'm going to do now is I'm just going to get Rob to turn onto his back. So normally what the therapist will do is make a tent with the sheets and get the client to turn onto their back. And there, Rob. It's all nice and comfortable. Just lift your head up. Okay. All right. So now here's Rob lying on his back. And again, I just want you to see, again, just taking away any surprise that might be there. If we're going to work on the front of his leg, we'll pull his shorts up, tuck it into the sheet. So you get a good bird's eye view here. Now we can work on the front of his shin, work on the quadriceps muscles again. We would just come up, if we could, just a little bit higher, maybe to about here. All right, nice and comfortable for Rob. He feels secure. Therapists can work all over this area. Okay. Again, work a bit on the feet if we had to. If we were going to work on Rob's arm and hands, I would just hold the sheet like this, standing back from him. Rob, can you just get your left arm outside of the sheet here? All right. In this way, I have his arm. Your therapist can work up and down. Again, we just stay at the upper pectoral line here, not exposing Rob's chest or anything like that. Working on his arms. The therapist could work on his hands. This way, do some things here, get him nice and relaxed. Okay, bring your arm underneath again. If we had to work on Rob's abdomen, most of the time I do things over top of the sheets. Really great to help out with constipation, irritable bowel syndrome, things like that. If I wanted to finish my treatment on Rob's head and neck, what I would do is I would have a chair, I'd get rid of my face cradle and my armrest here, and just drop them down, and then I would sit at the head of the bed, and then I could work on Rob's head and neck. We're going to have somebody come in and do some craniosacral therapy work, so you'll see a bit more what I mean there. All right? So there you have it. Always remember that when you're having a massage therapy treatment, you as the person on the table are always in control. Make sure that you let your therapist know that the pressure's not too much and that you're completely comfortable with everything they're doing. Any questions you have, always ask your therapist. They'll do their best to answer them. Anything you ever talk about with your therapist is always between you and them. We're bound to keep it between us. Client confidentiality. So anything you want to unload your mind, you can let your therapist know. All right, well, hopefully that was useful, and we'll see you in a minute. Okay, welcome back. So today I've got a really great stretch for your hip. In particular, what we're going to be stretching today is your iliopsoas or your psoas muscle. All right, so what I'm going to get Rob to do here, he's going to demo it out for me. I'm just going to get Rob to gently take his right leg off the table there, okay? And what this is going to do is it's going to give us a nice pull up towards Rob's spine. All right. Now, as you can see on my skeleton here, these red marks indicate where the psoas muscle attaches from. This is the inside if we were to go through your stomach. So you can see it attaches to your vertebrae. This here is your sacroiliac joint, or your SI joint, referred to as sometimes. The muscle travels down here and attaches to this little point of the bone here. So you can see that it has an effect on your spinal cord, on your sacroiliac joint, okay, and directly across your hip joint. So it's a very important muscle. Oftentimes, if you have back pain, or if you've ever had the feeling that you have to like throw your hip up or pull your hip up a flight of stairs or a curb, it's usually the psoas muscle which is being affected. Again, you can simply add some muscle energy work. Muscle energy means you just fire the muscle for a couple seconds. Okay, in this case, I'm going to get Rob to lift his knee towards the ceiling, just very gently, 10 to 15% of his energy for about 5 seconds, and then I get him to release, okay? And that's going to allow his muscle to stretch. You really have to do, when you're doing muscle energy, you really just want to engage the muscle just very gently. It's like 10 to 15%. Always remember that when you're stretching, it shouldn't hurt. If you ever feel pain, stop stretching right away. You should feel a gentle pull, and as soon as you feel a pull, stop until you don't feel a pull anymore. All right? You're always going to want to consult with a healthcare professional before you do anything radical as far as your activity level goes. Don't just try a triathlon because a friend dared you to, okay? And anytime you're doing stretching, always ease into it. Welcome back. Today I'd like to talk to you about gratitude. When you drink water, remember its source. That's a quote taken from a book of daily meditations, 365 Tao, written by Dang Ming Dao. How often do you think about all that has to happen for clean water to run to your tap and then into your glass? I mean, really think about it. Most of the time we don't give it much thought at all. It could be said that more and more people are becoming more aware and concerned about where their food and water is coming from, but I feel the vast majority of us don't even give it a second thought. I think I have an easy way for you to change the way you think about yourself and the world around you. An idea that if you can put into use today, can completely change your life. And it only costs you $2.26. It's an idea that if you put into use can have a lasting influence on not only you and your family and your friends and coworkers, it's everyone and anyone that you come in contact with every day. I'm going to suggest that the next time you're at the mall, you head into the dollar store, the whatever store is there, Dollar Tree, buck or two, and buy a notepad and a pen. Now here's the harder part, finding the time. I'm going to ask that you choose a day in the near future and you plan to get up about a half hour early. Pull out your paper and pen and write down a list of all the things that you're grateful for in your life. Fill up the whole page. It may sound very simplistic, but when you start your day by getting into this attitude of gratitude, your day will be much more relaxed and much more productive. When we write things down in it, it causes us to really think about what we're writing down, and this causes our actions in life to change. Start with something simple like, I'm so happy and grateful for this wonderful day. It doesn't matter what the weather is like or what day of the week it is, just be happy and grateful. I'm so happy and grateful that I am healthy and my family is healthy. Maybe you want something that you don't have in your life at the moment, say a new job or a new home. Write down whatever it is you are thinking about as if it's already happened. I'm so happy and grateful now that I have the job of my dreams, or now I have the new home of my dreams. It might sound strange, and those closest to you might think it is strange, but I wouldn't be sitting here in front of you hosting the show if I hadn't done exactly what I'm suggesting. It wasn't that I was so happy and grateful to be hosting a TV show. Writing down the things I was grateful for caused me to focus on what I would really like to be doing with my life, which has led me here. Don't pass this off without giving it a try. Make a commitment to yourself to get up for the next 2 weeks a half hour early and write out your gratitude list. It could just change your life, and it's a great way to massage your mind. Well, that's all we have for today's show. I want to thank my guest model, Rob, for helping out. I want to thank Richard Hodgins, my producer, and all the volunteers here at Rogers who have made this show possible. I want to thank you for watching. I hope you learned something new. I also hope you take the time to give us some feedback about today's show by emailing your comments to massagematters@rogers.com. I encourage you again to take me up on my suggestion of writing out your gratitude list. Try it for 2 weeks. Start each line with I'm so happy and grateful for. I'm so happy and grateful now that. I promise you'll be pleasantly surprised at the way you will feel and how your days will start to improve. Please join me for our next episode, which will feature my special guest, Nicole Nefo. Nicole specializes in infant massage. We'll also have a little guest demo right here in the studio for her to work on. It's going to be a lot of fun. You've been watching Massage Matters on Community Connection, right here on Rogers TV. We'll see you next time.